And now we are moving from Egypt to Pakistan to Dr. Mursalin. Dr. Mursalin, CEO of the Pak One Health Alliance in Pakistan, bring a significant insight from managing One Health initiatives and strategies within a complex regional context. Dr. Mursalin, floor is yours.
Thank you very much. Am I audible? Am I audible?
Yes.
Thank you.
Thank you.
Thank you very much. And thank you very much for this nice introduction. And I'm really thankful and delighted to be part of this team presenting our experiences. So my talk would be mainly on the work that we have been doing with the governments and provincial and national governments for the promotion of One Health. And recently we completed a project on One Health event-based surveillance, which was supported by Rockefeller and ending pandemics. You see, and I would like to share my experience, our experience on that. And certainly we have like some case studies, and because that was also part of the question here that was sent to us, the case studies on One Health. So I would like to present those case studies. So our organization, a quick introduction, was established in 2014 to work and to promote the concept of One Health. It is very well established and recognized by all the relevant ministries and departments. And the main strength, in addition to our team and in addition to our offices and at the national and the provincial levels, we have a very good affiliation with the multiple government departments, because One Health is an intersectoral, multi-sectoral challenge. So we need to have connections and a relationship with the departments. We have board of governors, and we have already signed a number of MOUs, both with the national and international organization, and lucky to get a similar MOU with EMPHNET about 2-3 months back. So, but we are very much delighted to be part of this process. So I will first be talking about the One Health event-based surveillance project that we recently implemented. The theme of the project was to make early detection, to make verification, then you share this information at a central level and generate evidence for joint action. So we developed, as part of this, the main was to develop some ICT solution that encourage sectoral collaboration for early warning, to support early warning system, implement some One Health guidelines, tools, courses, SOPs for infections, diseases, and train key stakeholders in timely detection response to the outbreak signals. So this was not like a countrywide project, but we did at the policy level, at the national level, and then we organized some training of trainers workshops on this, both at the federal level and at in the province of Punjab. So this is the products that we were able to produce during this time. We did a mapping exercise. We did we developed training manuals on One Health and event-based surveillance, because in our country and maybe in others also, the indicator-based surveillance is very common. But indicator-based surveillance, you know, the scope is limited to the number of facilities reporting. And for example, in our country, this is limited to the government type of facilities. The private sector is not reporting at all on that. So event-based surveillance was very critical for us. In that sense, probably we were the first to promote the cause of event-based surveillance in Pakistan. So this was like our project completion workshop that we organized in March 2023. So this particular project on One Health event-based surveillance was actually launched in 5 countries, and Pakistan was one of those countries, and we were the focal point for this type of project. And so as part of this project, we developed a dashboard, integrated data dashboard, enabling One Health surveillance and early one. But just creating dashboard was really a big challenge, because the surveillance systems of multiple departments are differently organized, and their definitions could be different, their SOPs could be different. So, and they are not used to sharing any data to, earlier not used to sharing of data to other departments of ministries. You see, they were using with themselves. But we we started with health and you see the livestock department to start with, and probably later on we thought that we'll be also incorporating information from the environment sector and the food security section. So the outcomes of this One Health EBS project were able to set models of One Health intersectoral coordination. We created committees on intersectoral coordination, and you see the federal government and the provincial government, we were like the enablers, you see, the facilitators, because this is an NGO. So we were enablers, and luckily we had very good relations with all the main players in this concept. And we developed guidelines, and a large number of federal and provincial managers and field staff were from public health, veterinary, and vector-borne disease program were trained in EBS, event-based surveillance, detection, response, epidemics, outbreak, and One Health protocols, you see. Experience gained in this EBS One Health project was showcased widely, you see, both at the national and international level. Monitoring of the project outcomes to the predetermined project timeline metrics, that was done. So I will be now discussing some of the, because we wrote a paper on One Health case studies in Pakistan, and these are the you see sections from that paper. So a dengue was spread in the country. And
Dr. Mursalin, you have 2 minutes. So sorry for interrupt you.
Okay, thank you. So dengue was one of the, in the case study, it was very well organized. And so many departments were, you see, aligned to each other, like the human, animal, environment, social sciences, WASA, the fisheries department, police. And this was first time in the history of the country that so many departments were aligned, and there was, you see, showing coordination, both at the provincial level and at the district level. And many, you see, approach the salient features. You see, it was a very holistic kind of management of dengue, and that created case studies to be followed for other diseases and for other situations also. Then the recent COVID control, there was a national command and control center established, which was coupled with the provincial command and control center, all provinces and members, and in which it for three, you see, there was use of technology, clear and effective public messaging, coherent governance, and policy recommendations. Those are made. And several departments like ministries of finance, climate change were part and parcel of the steering and the technical group meetings. You see, it is not only health dealing it, and so many FETP program, NIH, international partners were it. And at the end of the day, luckily, we were able to manage the COVID situation in Pakistan. There are some other isolated examples, but you see unfortunately, these examples are ad hoc based examples, but you see some kind of trend or culture of having a continuous, regular, you see the One Health studies or One Health patterns are missing. And every time there is an epidemic, you see this is to reduce. So some isolated but scalable option of One Health implementation available, coupled with, but at the policy level, the One Health is very well realized, and it is felt that it should be promoted. There is a general awareness and sensitization at community level and at multiple level, intersectoral coordination. So no significant but regularly among different departments. Limited evidence for joint actions or joint operation is there. Absent integrated surveillance is missing. Certainly, the surveillance programs of livestock, they are different. But recently, we created this example of integrated dashboard. You see, One Health. But that was a beginning that we made. But there were still so many challenges in that context also. Lab facilities, the test kit were problem, deficiency of a common platform to bring academicians public and private. Regular platform is missing, and that needs to be promoted and developed both at the public and private sector. And there are some other players and stakeholders which have to be brought to the net of this platform. So thank you very much. The recommendation, need for an active and One Health Secretariat, governance and regulatory frameworks has to be devised, extensive sensitization, integrated One Health disease surveillance and monitoring mechanism need to be promoted. Education department, media needs to be activated for One Health. Areas like food security, environment, and waste management are not very active in One Health. It's only livestock and you see, and the public health. We need to have broader plans for One Health operationalization, and recent use of One Health joint implementation. You see the process that WHO started. Probably it has to trickle down to the country level and also to the provincial or even to the district level. So thank you very much.